Now, the DRC outbreak has close to 2,000 confirmed death cases. Now, why has this particular Ebola outbreak been so difficult to contain?
The reason is because it's been going on probably since at least January, looking at the latest data, that this was something that went undiagnosed and had a lot of momentum before it came to the light of public health authorities, which was in May. So if you give a virus like this a head start, especially in a part of the world which is war-torn, controlled by militias, where there's a lot of distrust and denial of Ebola as an actual problem, it's going to get to that point. And now the key thing is that we don't actually have the community owning this response, that the response is largely coming from without. And we need the community members there to actually recognize that there is value in being diagnosed and participating in contact tracing and going to Ebola treatment units.
I suppose on that note, the WHO is saying the virus is spreading faster than response efforts. What's the biggest gap in the current strategy?
The biggest gap is contact tracing. So when you look at the new cases that are occurring, the vast majority, I think around 80% of them, are occurring in people that they don't even have identified or haven't identified as contacts of cases. So that means that there are chains of transmission that are basically invisible that are leading to new cases. Also, many of the deaths are occurring in the community. Deaths that occur in the community are deaths that are not really, have not come to light for public health authorities. They're people not going to Ebola treatment units, and then people are handling those dead bodies, which are highly infectious. So that's kind of causing this feedback loop, is that they can never catch up because there's this whole shadow outbreak occurring that is completely separate from what's happening in the Ebola treatment units. And until more contacts are identified and more people are being treated in Ebola treatment units, we're going to be playing catch up with this virus maybe for over a year or so.
And I suppose the other worry is of the virus reaching major centers, like we saw in our report, reaching places like Kinshasa.
Definitely. So long as this outbreak continues to burn in those provinces in the DRC, all of the other neighboring countries, as well as the bigger cities in the DRC, are going to be at risk for importation. Hopefully, this case related to the boat is not going to turn out to be Ebola, but this is kind of the stance that all of these countries and all of these other provinces have to take, that as long as Ebola is festering in that part of the world, all of the areas that are adjacent to it are going to have to be on a permanent stance of looking for Ebola and being able to run down those cases as quickly as possible.
You talked earlier about the DRC owning the response. You also mentioned the challenges with security in some areas. But as we heard in our report, frontline health workers talking about going unpaid while facing these enormous risks on the job. How much does that undermine the control of the outbreak?
It completely undermines the outbreak. If the healthcare workers, the ones that are being asked to risk their lives, to handle the dead bodies, to do safe burial practices, to take care of these patients, if they can't do it in a way that actually rewards them with a salary, they're not going to do it. And that means that we're going to have less and less resources to bear on this outbreak. And that's going to cause it to last longer. The other issue is that the community members there are really, a lot of them are in denial. Some of them believe that don't believe that Ebola is actually a thing. Some of them don't think that they can get any valuable treatment in Ebola treatment units. And we've seen them really be resistant to safe burial practices. We've seen them burn down Ebola treatment units. That has to stop. There needs to be an effort to get the community engaged, and they need to own this outbreak, meaning the people that are actually in the outbreak zone have to recognize that there is value to participating in the global health response right now, because otherwise this will go for several months to years, just like the prior outbreak that occurred in that region of the world.
We also mentioned earlier the WHO calling for a full trial of Ervebo against this current strain circulating in the DRC. What are the stakes of that decision?
I think that right now what you're seeing is real desperation because they don't have countermeasures for this species of Ebola. And there is at least anecdotal information that this vaccine, which is targeted towards the Zaire species, might have a protective effect. Right now, there is no Bundibugyo vaccine. There are some in clinical trials. So this is one countermeasure that may have some benefit. And I think it really underscores the urgency of getting any resources that are available, even if they aren't completely proven, to bear on this outbreak, because it is spiraling out of control and it is growing at a very, very fast rate.
Okay, we'll have to leave it there. Amesh Adalja from the Johns Hopkins University Center for Health Security. Thank you very much for your insights.